a warm welcome to everybody. Actually, it's a very warm day where I sit here in Stroud in Gloucestershire. Thanks for going through the format of this afternoon session. It's a really exciting session looking at the Standing Together Cymru project. The HousingLIN has been really pleased to link in with the Mental Health Foundation, the work of Jolie and the team over recent years, both on this project in Wales, but also, and she may touch on this in some of her earlier work, in London and the surrounds as well. A really important work which was very much about co-produced with residents within a sheltered housing setting. But I don't want to spoil the fun, so I know you want to hear from Jolie and Miranda on both of it. But our happy hour sessions are a really great way of sharing research, practice, policy development, and giving you an opportunity to hear at first hand the latest from the people doing some fantastic work on the ground. And as I said, the HousingLIN's been really proud to be part of this, both as an advisory group member, but also to share the findings through the website. And again, a big thanks to the Mental Health Foundation for supporting the mental health and housing pages on the HousingLIN website, where we curate a number of resources relating to the needs of people about their mental well-being within a housing setting. Today, we're looking very much from a Welsh perspective, and we're joined by two great people. The first is Jolie Goodman from the Mental Health Foundation. She's the Programme Management Manager for Empowerment and Later Life. And she'll be joined by Miranda Quinney from the University of South Wales. I'm assuming a PhD, Dr. Miranda Quinney, so congratulations on that. And you're going to look at the experiences of people taking part in the peer support groups as well. And obviously this follows hot on the heels of Mental Health Awareness Week, which was last week. And for those of you who are not aware, it's a Dementia Action Week this week as well. And I think there's some parallels here. I'm not saying they're the same, but there are parallels around sort of addressing issues around loneliness and isolation, which come to the fore, and how to support and provide better care and support opportunities for those living with mental health and or dementia and their carers. So without further ado, let me pass over to Jolie. Jolie, over to you.
Okay, thank you so much, Jeremy, for the introduction. I'm also relying on the slides being so I will be saying, turn to the next slide, but not yet, to Sally. But so I'm going to give a really big overview of some of the work that we do in the Empowerment and Later Life team, with a definite focus on the work of Standing Together Cymru, and then we'll go to Miranda, who will provide a little bit more in-depth thinking about that piece of work. So what I'm talking about is the importance of social connection for good mental health, supporting older people's well-being through communities. And I think social connection feels particularly important because I think that's at the heart of all the work that we do when we bring together peer groups of people in later life housing schemes. And the communities refers to the later life housing schemes, and also what it means to be a peer, but also part of a peer group. And I think the Mental Health Foundation, we're still defining later life as beginning at 55. So when I first started working for the Mental Health Foundation, I wasn't a peer, but now I am. Can we do the next slide, please? So the Mental Health Foundation, we've grown quite a lot since the pandemic. We now we're in 4 different nations with offices in Northern Ireland, Scotland, Wales and Cardiff, and in London. And we have quite a big vision, and it's for a world with good mental health for all. And our mission is to help people understand, protect and sustain their mental health. I sit in the programs area, so I think we do kind of universal and targeted approaches to mental health. And I think, particularly since the pandemic, I think we've all been thinking very much in terms of what does it mean for public mental health. I think there's a lot of change in how we're talking about mental health, but so I kind of think it's really helpful to think about what a mentally healthy society looks like in the future. And I think you'll all be familiar with this idea about prevention. So for the foundation, prevention is our priority, and that's across the whole life cycle. So how do we support people to stay in good mental health, and given life's challenges, to manage your mental health when life is difficult? So in our kind of targeted and universal approaches, we also think about how collectively as a society we can look after our mental health. Can we go to the next slide? So as Jeremy has already mentioned, last week was Mental Health Awareness Week, the theme of which was loneliness. And I think we've been thinking very much about the individual experience of loneliness across different ages. So there was a sense that perhaps we've talked a lot about how loneliness impacts people, but we wanted to really bring attention to the link between loneliness and mental health. And we've asked people last week to engage with this idea that I've been there. And we've also kind of been thinking about the stigma around loneliness and what that means at different times in people's lives. So can we do the next slide? So I've got some facts here about what some research the foundation found out about later life. So 1 in 10 people over 65 reported that they felt lonely some or even all of the time, which is quite a big figure. Then we also look at 1 in 4 people saying they felt isolated often or some of the time. And I think it's really important to note the distinction between being lonely and being socially isolated. Some people might choose to be a hermit, so there's something around isolation that's important to know. But I think what was crucial for Mental Health Awareness Week was the sense that if you're lonely and socially isolated, and this is not what you want, this is not a positive factor in your life. And again, around 10% of people aged 65 or over said feelings of loneliness made them feel worried or anxious. Can we have the next slide? So one of the things that we did in the Empowerment and Later Life team was to produce a booklet of top tips for how to reduce loneliness in later life. These are very practical ways to kind of manage your day, your time, your routines. This was a piece of work which we were lucky enough to co-produce with the organisation Dementia Adventure, as well as for people taking part in the programmes we're delivering. In particular, one picture this. For people, and as this is dementia, this is a week when we're thinking a lot about dementia. I think I reflected from the focus group for carers that actually it was perhaps easier to be a carer and to talk about being lonely, because there've been, for people that we were speaking to, quite a lot of change in the dynamics of the relationship with the person they were caring for. For people in later life who were not in caring roles, I think there was greater stigma around using the word lonely. So people were very keen to talk about ways that they managed, ways they kept busy particularly. So please, I think the link to this is going to be posted in the chat. So please do have a look at this resource. And I think it's sensible things. And I always remind people that it does take time to address. If you want to make a change in life, it's to be gentle with yourself. And this takes time to realise. Okay, can we go on to the next slide? So before talking a lot about Standing Together Cymru, I thought I'd like to just talk about some of the common elements in the projects that I've been involved in since I joined the foundation 7 years ago. And there's some ingredients that I think are quite important to that work. And one of them is a bit of a clue in the flag. It's about listening completely. So we've got projects which have a particular facilitation style and something that's really noted by participants, but the people that facilitate Standing Together type of groups are very interested in people and people's lives. And this was an event that I think Jeremy was at as well, but it was the end of the Standing Together London project, and it was an event at the House of Lords. And what I take away from that was it was just very exciting, because there were so many people in later life, and actually the staff there were really worried about the number of people in wheelchairs, but it was a real celebration of the project, but also the people that took part in that project, and also for those people who were part of the Standing Together groups in London to have the opportunity to come to the House of Lords and have tea was something that was really joyous and celebratory. Can I have the next slide? So we moved from Standing Together London to Standing Together Cymru, and we have produced this quite long evaluation report. And I also would just want to, for those of you looking through who might feel a bit daunted by this report, there's a helpful introduction, and there's some key recommendations that I think are good ways into the report, and it's really beautifully designed, so you can also pick out quotes from the people that took part and the staff, and there's a couple of case studies in there. So it's quite a daunting document, but I think it's worth having a good look at. There's a quote that I've pulled out today because I think it's a good one for the project, and it's a little bit complicated, so I'll read it slowly. Oh yes, we've got stronger. You know we've got stronger. We don't hold back with each other like in morning coffee, you know, discuss things that we discuss here. You know we wouldn't. So there was something about the Standing Together groups having deeper conversations than perhaps usual coffee mornings or activities. It's about bringing people together to build their social connections, but also to build relationships between those facilitating and those taking part in the project. So there was something very important about acknowledging, and it's part of the evaluation report, how people felt listened to, which they said it wasn't their usual experience, but also that people were interested in their lives, and therefore it was possible for them to have the different, deeper conversations than they perhaps would have a usual coffee morning. You know, things like I've spoken to people about issues I haven't talked to any about. It wouldn't be appropriate for me to talk to my family about this, but within the group, I feel safe to talk about this. And so I start at the next slide. So when we started, which I think was it was about 2018. These were the aims of the project. So it was reducing loneliness and social isolation, which feels very in keeping with Mental Health Awareness Week. Improve emotional well-being and knowledge of coping strategies. So how do you look after your well-being on a day-to-day basis? And then increasing meaningful activities, sense of purpose and community engagement. So this is all about bringing people together in peer support groups. And then the last aim was really about the later life housing sector. So people, retirement housing staff and volunteers will be better equipped to support the mental well-being of residents. So there's something about building confidence in the later life housing sector about how you talk safely but supportively about mental health. And I think because it's so because COVID feels very pivotal in the work that I've been leading at the foundation. Obviously, halfway through the project, the pandemic struck, and we went from delivering face-to-face to delivering remotely. And that's kind of been a change that I will reflect in this presentation. So with Standing Together Cymru, there was a real acknowledgement that it wasn't possible for people to join digitally at that point, so that people joined through quite small groups of telephone conference calls. And so we have I think it's very relevant for all of us. So we have this way of working. There's a new way of working that's come through the pandemic. It's about working as we are now. We can reach a lot of people, but what does that mean for later life? So I'm going to take you on to the recommendations, the next slide. So on the report itself, there were some recommendations that were very Welsh specific. These were things about like ensuring that the Welsh governments tackle inequalities in the new mental health strategy, and also thinking about how the Welsh government funds local authorities to implement age-friendly societies around commissioning peer support groups like Standing Together Cymru. And again, the Older People's Commission in Wales encouraging and supporting the development of peer support groups. So I just highlighted two because I felt they fit the theme of social connections, but there's something about how do we as a society value enough social connections? And there's something about how peer support is a way that we can bring people together. And perhaps this should be included actually in care plans, so that, and kind of people, we need to think very carefully about how people can access this type of support in future. Is it something, if there's transport issues or barriers like that, how, especially in Wales, can this be tackled? Have a sip of water. I've got to also acknowledge, which I didn't at the start, I'm on my 7th day of COVID, so yeah, have to bear with me. And if there's anything you haven't understood, I've said, please put it in the questions and I will happily clarify. But this is really important now for how we work going forward. it's about addressing digital exclusion with clear milestones and targets. So, you know, the pandemic, we adapted, but we couldn't bring people together online, but because there was too low digital literacy. So it's something about how this work is taken forward in the future and planned. And it's not just about addressing young people's needs for digital inclusion. We know the importance of later life digital inclusion. Okay, thank you. Next slide. Okay, I'm going to bring you now to a couple of projects that ran sort of from the London office. So this came after the Standing Together London project, but it was where we brought the element of creativity to the peer support groups, and how this is actually what happened to this in the pandemic. And there's something very, well, I have an artistic background, but I think there's something very magical about bringing people together in groups, but also collectively making art together and using a number of devices like drawing to music, making portraits. There's something very joyous about this for me. And then we came into the pandemic, so the creating communities, they didn't go online in terms of a Zoom call. If we go to the next slide, what happened was that we worked with Anchor Hanover with something called Sparko TV. So we were literally coming up on people's TV screens, and a member of a group, it just gives a tiny bit of feedback in this film about her experience of that. So you're okay to play that. Thank you.
You're in the pools? Yeah, I do. No, she wanted the postcode doctor. She didn't tell us. At least I can look at each one and I can talk to you and laugh and everything. So I'm not on my own, so I'm happy. Yay!
Okay, and then from creating communities, we went to the next slide, which is this project picture this. Oh, she's going to say again. So picture this, which started this time last year and will continue delivery for a year, was where we gave people an actual tablet and, importantly, data and a bag of art materials. And people had tailor-made training to get online and to get familiarity with the tablet and how it worked. But also, they also had 12 weeks of creative sessions to get used to being online collectively. And there's another film coming up on the next slide, which talks about somebody's experience of the project.
So, first question is, what difference has the course made to you?
Well, as far as the tablet is concerned, it's made a great difference. I've been able to go on Facebook, I've been able to go online, I've been able to get cheaper insurance for my scooter by using this. I've been able to get a better life insurance policy on this. So it's made a great difference in that respect, absolutely. I'm sorry I didn't go on this years ago. So absolutely brilliant.
Amazing. And what about the art classes and the...
Well, like I said, I'm no Michelangelo, and I never will be, and I'm not very good at it, but I'm trying.
Yeah.
I enjoyed last week, it was pretty good.
Good. And enjoying seeing other residents?
Oh yeah, that's very good, just having a chat.
Yeah.
We do meet downstairs and have a chat as well about what we're doing, so yeah, it's good.
So I think something that's really become apparent to myself is digital exclusion is not going to be something that's solved in a decade. There's always going to be new generations of people that are digitally excluded. So it's something that people will probably always need support with as they get older. And it's something very much about inequalities, about how we acknowledge this issue and how we make sure that people can be well supported to get online. Because if you think of all the ways that we're now, since the pandemic, you know, think about your accessing your GP, you know, there's I had to go through something through Ask My GP. I actually had to go in person, and there was a woman who was talking about, she was 70 and neither her nor her daughter had been able to make an appointment. And the receptionist said to her, "I'm sorry, but no, I can't book you an appointment. You have to go through the app. You have to do this online." And then so there's just something about making sure that as a society, if we're going to create GP systems which are so rigid, we at least try our best to equip people so that they'll be able to access them. So my last slide is all about some recommendations to tackle digital exclusion in later life. And this comes kind of on our Mental Health Awareness Week as well. So it's kind of pay particular attention to digital technology in residential care settings. And I'm sure many of you here are very much aware of the challenges around providing Wi-Fi or providing people with data and who's going to pay for that. But it actually, I think it's since the pandemic become much more essential. And then there's placing greater focus on the training and support for people in later life to develop the skills and confidence to use digital technology. And also, I think there's a lot for the staff to also be trained to feel they have the confidence to support people so that they can build, so people can build social connections, not be lonely, not have that impact on their mental health. And then we're just talking about much broader training in libraries and community spaces for older adults to learn more and to keep learning. And also I thought with picture this, one of its strengths has been it's an ongoing issue to keep learning about. I mean, it is for me personally compared with the other generation of people living in my household, but there is something about building confidence but knowing where to get support. So I think the picture of this project has worked with 100 people, and over a quarter of those are buying their own data now, which I think is a really high success rate. And I'm going to pass over to Miranda, who will take you back to Standing Together Cymru and that project. Thank you.
Jolie, thank you ever so, and welcome Miranda Quinney. Just while Sally sort of changes the slide, just to say we will be posting information up on the chat box, and please can I remind you, if you have got questions, do put them in the Q&A box rather than the chat box. So thanks for excellent presentation, and I'm glad you're on the road to recovery, Jolie, albeit still testing positive. Thanks for joining.
Great. So yes, here I am. You'll probably notice I've got to do a bit of translation on this slide. First of all, I'm not quite a doctor yet. I've got all the people looking at my paperwork. So yeah, I've passed the exams, I've done the thesis, but I'm now doing my corrections. I'm learning about a new system. I'm delighted to be doing it as an older adult. It's been a voyage of discovery, so I'm still a missus, but hoping to be a doctor soon. The other bits I need to translate, actually, what was it I was studying? I'm calling it a longitudinal, descriptive, phenomenological, get my teeth back in, study of the experience of participants in a peer support group for older adults. Now, you'd think we could express ourselves very easily, but in academia, it seems there are certain words one has to use. So just to translate that, basically what I did was work with a group of people who were taking part in one of the Standing Together Cymru groups over time. So that's a longitudinal bit. Then descriptive phenomenological basically means that rather than evaluating what was good or could be improved upon in the project, what I was doing was trying to understand what it actually felt like to take part in the project. And that's what phenomenology is, I've now discovered. It's understanding the phenomenon, the experience of taking part. So if you just move across to the next slide, you can see also my skills on technology are not that great. I was really lucky because this particular bit of work was a collaboration. It was a collaboration between the University of South Wales, the Mental Health Foundation, and rather in extraordinary fashion, the European Union, given where we are at the moment, who are looking at funding projects and helping to fund projects and study of things which are really topical at the moment. And if you look at Wales, the over 50s represent about 40% of the population. So that's a really big chunk of the population. But what they've been doing in Wales, they have kind of taken this quite seriously. And that those words in the middle there, how do we make Wales the best place in the world to grow old, actually comes out of the strategy of the Older People's Commissioner for Wales's documentation. So that is their goal, is to make Wales the best place in the world to grow old, which is quite a big ask, actually, for anybody. And in so doing, they've looked and realised that they really, really do need support from the third sector. They can't just do it by legislation, which I think we all knew, which is really where the Mental Health Foundation came into this project, in that they'd already done Standing Together in London and had been applying for funding to develop the work in Wales, and they were very successful in that they were able to get the funding. And then I was able to jump into that from the University of South Wales in terms of looking at that project. The other thing I think is quite interesting about the Welsh strategy was they, yes, wanted to provide support for older adults. And Jolie mentioned 55 plus, the Mental Health Foundation. I was kind of slightly shocked when I joined the University of South Wales at 52 that I was also an older adult already, because in Wales, the 50 plus, for quite a lot of, under quite a lot of criteria actually, is when a person becomes an older adult. Rather than the 65s you may hear in England. So yes, I was an older adult of 50 plus, but that also sat rather nicely with the Mental Health Foundation's principle of preventative measures and looking at people across the lifespan. Because if you look at the average lifespans at 50, one's hoping to have quite a few more years to be moving forward and enjoying life. And what jumped out at me was this project Standing Together Cymru, was something which is looking at how do we live a long life well, which, you know, many of us are going, great, having a long life, but I don't actually want to live it in decrepitude. I want to live my long life well. So that's the idea of well-being was really, really exciting. And the second prong of the Welsh Government's strategy was actually realigning how we value older adults. And again, something which came back at me again and again, and I sort of sit there as an older adult and look at the older adults in my life to think, actually, this is something that if all goes well, we all want to become older adults, but we'd like to be valued as well. And there's something that's sort of happening, this ageism in society. There's something going on there that really we need to do something about, and how do we tackle it? And so I was very excited to get the opportunity to work with the Standing Together Cymru groups, because it struck me that listening to older adults and hearing what they have to say and giving them voice is part of a process that perhaps means we will value older adults, and I'm hoping, you know, myself and the people that are around in a much more positive way, rather than pushing them to one side, which we have quite a youth-centered society. So I think something needs to be done about that. So all of those things meant that I packed my bags, left well, I didn't leave my home in London. I started commuting from London to Cardiff to conduct this study. I gave up my my day job, which it is my own company, but that's working with people at end of life, and I put that on hold, listening to their stories and developing that business for 3 years in order to proceed with this PhD, which I'm hoping is about to come to a conclusion. What I wasn't to know was that in the middle of all of this, a pandemic, which Jodie's reminded us, was to hit. So let's just jump to the next slide, please. So what was this thing? This thing, Standing Together Cymru. Jolie's mentioned peer support. And again, that was sort of another phrase that I hadn't really come across until I entered. I had sort of heard it, but I didn't really understand it when I went into academia. And why was this project so important? Well, it wasn't just about having professional facilitators going in and delivering a project. The vision, which I have to say the pandemic did throw a little bit of a kibosh onto, but the vision at the outset was to have groups that would then run themselves. So the members of the groups would pick up, you know, someone put their head above the parapet and said, yeah, I'm going to run it. So what happened with the groups at the very beginning, they were professional facilitators. They worked with the housing associations, and the housing associations provided a number of independent living housing schemes which were happy to take part in running Standing Together Cymru groups. Within each of those schemes, within their own lounge areas, they had a weekly meeting. And for the first 6 months, that weekly meeting was run by one of the Mental Health Foundation's fantastic, I have to say absolutely fantastic facilitators, who are really, really good at listening, encouraging, making sure those really important conversations can happen. And the aim was that towards the end of that 6 months, there would be a transition to peer facilitation, so that some person or persons within the group would volunteer to say, yeah, you know what, we're going to run this. That's a really hard thing to do. But that was the vision, and that's why this is longitudinal, because what I wanted to do was to understand the experience whilst the professional facilitators were in place, then to understand what happened when the professional facilitators left the building and the group was left to run itself, but not just do that, you know, for a short period afterwards, but to keep doing that for up to a year after the professional facilitators left. So that's why this longitudinal. I was really lucky. It's quite unusual, I'm told, within a PhD context to be able to do a longitudinal study. So that's what I was about, and see what happened. So next slide, please. So what did I do? As I say, I interviewed individuals within the groups in 3 stages. The first stage was when the professional facilitator was in place. The second stage was when we were hoping that a peer facilitator would be in place. And the third stage, 6 months after that. So let's just kind of see what happens. So again, looking a little bit at group dynamics, how groups develop, how they can break up, how they can reform. You know, would anybody actually put their head above the parapet and say, yeah, you know, I want to run this group? At the beginning of all of this, I didn't actually know whether that would happen at all. My method that I used for the study was to interview. I say it was to interview and not to interpret. Now that was really, really hard. I didn't realize how hard it was going to be, because of course we all carry baggage. So when somebody says something to you, we kind of start interpreting straight away and we'll say, oh yes, yes, me too. I sort of, I was trying to hold back on all of that. And that involved a whole process of basically me trying to record all of my prejudices, which, believe you and me, were a heck of a lot more than I'd anticipated, and quite scary. But the idea being to be able to acknowledge those and then put them to one side to try and not let them influence what I was hearing, to really allow the participants to give voice to their experience, to actually say what they wanted to say about the experience. And something really interesting happened here. I mean, again, we've just come out of Mental Health Awareness Week, talking about loneliness and isolation. And I have to, again, be honest, at the beginning of all of this, the general assumption, and it wasn't just my assumption, the general assumption amongst the research team, there were 4 of us together, I've got 3 supervisors, was that this would really be about loneliness and isolation. So there are people who would be describing their experiences of feeling lonely. They would come to these groups, they would, that's used the word cure is the wrong word. They would recognize the fact they were lonely, they'd find techniques to no longer feel lonely. However, that's not something that I could assume. I had to put that to one side, but it was kind of bubbling around in my head. And I'm really glad that I used the method that I did use, because to give you a quick sneak preview, none of the people who I interviewed expressed any loneliness whatsoever. In fact, they expressed a whole other series of emotions. Now, that's not to say that they weren't lonely, because of course, one of the things, again, if you read that wonderful evaluation that Jolie signposted to, one of the things we think about is with any group like this, you know, the people can be self-selecting. At the beginning, all the participants were self-selecting. They weren't being invited to join the groups. And question, if it's a self-selecting group, actually the people who can potentially gain the most benefit from it are those the people who will self-select. Now, with the arrival of the pandemic, the format of the groups had to change a bit, in that rather than being self-selecting, brilliant. Rather than being self-selecting, they were then signposted towards the new format, the telephone groups that Jolie was mentioning. But I thought that was really interesting. I did think this was going to be a PhD about loneliness and isolation. I spent 6 months reading about loneliness and isolation. And in fact, I found myself needing to learn a lot more about well-being and how we can prepare ourselves as older people, as people at all, for well-being in older age, and what we can do about that. So just skip to the next slide, please. So yes, results of the research. Now, the results of the research came in 2 categories. There was the experience of the group members, And again, there's a lot there that's self-explanatory. And there were the experiences of the group leaders. So again, I was absolutely thrilled to find that the group that I worked with, in fact, one of the participants in phase 2, so as soon as the professional facilitators left, one of the participants did volunteer to become the peer leader of the group. But not only that, to my amazement, later on down the line, we had 2 more facilitators who popped up out of the woodwork. And indeed, one of them in the COVID period, I was absolutely, and this was the very last interview I did, she actually said, well, actually, I'm running. I said, well, how's the group going? Knowing the situation that retirement communities were in at that point, and people were not actually being encouraged to meet each other at all. She said, well, actually, I am running the group and we're doing it in the garden. And I went, oh, crikey. So absolutely thrilled to receive that. So my results come in 2 sections. The first section is the experience of the group members. And then the second section will be the experience of the group leaders. Again, none of this will be amazing to hear. You know, it's not rocket science. What did they think? They really, really enjoyed the group. And I used that, the title, Something to Look Forward to, because they really, really did talk about this is something, this structure in our lives. It's a weekly event. It's something we can look forward to. But it wasn't prescriptive. There was no requirement for minimum times to attend. You know, participants could come once or they could come every week. And again, this will feed into some of the tips that come. We seem to like top tips, actually. I've got top tips at the end of this as well in terms of running sustainable groups. But, you know, this particular group that I worked with, they had a previous group that was occurring, and it maintained its format. It was a slimming group, which I thought was rather great in that they paid a weekly subscription, which they then put together to go all out for lunch at the end of each term. So that's great for a slimming group. But they formed the core group. And then what happened off the back of that was those members joined, and then more people started coming. And they had up to 15 people attending I think it was every Tuesday for a couple of hours in the morning. And that's continued. As I say, even through COVID, the numbers went down to about 8. And again, the eating seemed to continue remarkably, because within the pre-COVID times, they managed to extend their pub lunch sessions, the slimming group's pub lunch sessions, got extended and opened up to other members of the Standing Together group. So they all went off, they had Christmas lunch together. I think they went off about once every 6 weeks or so. And the people who attended the slimming groups got sort of a discount on their lunch because they were paying more. But the other members paid full price, but they extended their groups. They created new connections because of that. I wasn't able to say, why did you open connections? Because that wasn't my methodology. I was waiting for them to tell me, ask very, very few questions, and really just said, you tell me what the groups are like, tell me what happens. And they just talked. I listened to what they said, wrote it down, then analysed it. So what sort of things did they tell me they talked about? Well, they, again, as Jodie mentioned earlier, they found they were able to talk about difficult subjects like death and bereavement. And this is in line with a lot of the research that actually talking about some of these difficult subjects can be hard with your own family, and sometimes even with your own friends, particularly if they are of a different age. This whole peer support side became very, very powerful and important. And there was one lady in the group who actually was quite a lot younger, and she was very explicit. She said, basically, you know, in the course of all of this experience, she suffered not 1 but 2 bereavements, and she felt that the members of the Standing Together Cymru group were the strongest supporters for her, and rather than her own circle of friends. She didn't actually live at the retirement community. She was a daughter of one of the people who were living at the group. She attended the group in order to support her mother. And I thought that was fascinating. She said, you know, these ladies are, they were all ladies. In this particular group, they were able to provide me with more support than my friends were. So I thought that was quite something. The support changed, obviously, once, I say obviously, the support did change once the professional facilitators left. So again, I really acknowledge that the job that the professional facilitators did was was remarkable, and this will come out in my recommendations. The conversations about difficult subjects like death and bereavement did change once the facilitation was in the hands of the peer group members. Again, perhaps not unsurprisingly, some of them felt quite out of their depths, allowing or encouraging conversations about death and bereavement. So they tried to keep the conversation to softer subjects and subjects they felt more comfortable with. And again, some ideas about tips on running groups like this will come out at the end of this. But in that phase one, when we had professional facilitators, the quality of the conversations was highly recognised and appreciated. They learned all sorts of stuff, and not only did they learn, but again, I think this comes out in the evaluation, they felt able to teach their facilitators. Again, the young facilitators learned all sorts of weird and wonderful stuff. I think one of them was teaching them how to make butter out of milk. They were teaching them all sorts of historical facts about their own younger lives, and that learning and teaching went on into phases 2 and 3. But again, perhaps more practical, you know, where can you, whilst they could, where's a good pub to go out for lunch? Would you recommend someone who can help me with my electronic buggy? But again, an opportunity to share knowledge. They really felt like they belonged. They created a new name for it. It sort of changed. There was the Tuesday group, there was the Standing Together group. They had all sorts of bloody names for themselves. And I think that's something that happened across the board with many of the Standing Together groups, because this was just one of what was hoped to be about 28 groups. And I think I'm right in saying we had about 14 or 15 in the end, because there was some groups that actually coalesced because of the pandemic. They didn't all happen at once. They were started in cohorts. So some actually started in the pandemic. So the number, it wasn't possible to have quite as many groups as been hoped. But many of the groups did decide to name themselves. And yes, I've mentioned empathy. So then perhaps moving on to the experiences of the group leaders. This for me was a really exciting thing, because what I did discover was in fact, the group that I was studying was actually the only one that did have a peer leader that emerged from the ether. That's not to say that others would not have, had we not had a pandemic, or indeed had there been more time to check in with them. I was quite unusual in that I was still checking in with them a year after the professional facilitators had left. Most evaluations will finish between about 3-4 months, if they're lucky, after the end of the project. So I won't say this is definitely the only one, but certainly from the conversations I had with the team in Wales, this was quite unusual in that the peers did actually create an ongoing group with their own peer leaders. One can also say, is that perhaps because they were being studied and they were getting a lot more support? Who's to know the reasons for that, but there were peer leaders there. But what came out of this was being a peer leader gave them meaningful goals and structure. And this is really, really important. They were being listened to. They were being asked for their opinions. They were being given authority, which was superb. They got appreciation from others. They had achievements. They were able to reflect their earlier experiences in life and in work. They were providing a service, because how many people who are living in retirement communities actually have the opportunity to provide a service? And again, as I say, they're using their previous leader experiences. I think one of the ladies I spoke to had been a leader in various different voluntary groups. Another one was a leader in her local church. They were really proud of what they've done. And the word, I don't know why I haven't put in this, but the word I would really use is they're engaged. And this whole business about being truly engaged in well-being. When we get that feeling of being really engaged, I got it actually when I was writing my thesis, whilst it was extremely unpleasant. I felt truly engaged. You know, time just flew by. And you hear that again and again, doing something rather, the time just passes by. That's how the group leaders felt. They felt they're planning for the sessions, they're doing of the sessions, they're engaging with the people at the sessions. It was so meaningful. So it's something that's made me feel really passionate about how is it we can find opportunities to actually be able to engage. So then moving swiftly on to top tips. Thank you very much. Now, this wasn't really the outcome of my research. I thought it was quite practical because I felt so passionately about what happened in this group that I thought, gosh, wouldn't it be great if we could do some more of these? So what I noticed was, as I say, we had not one, not two, but three leaders of this group, but they all had really different styles on how they ran groups. And the beauty of Standing Together Cymru was that there was no prescribed way. You know, there wasn't a t-shirt they had to put on. There wasn't, this is what you're going to have to do in session 1, in session 2, in session 3, which does have its place. But for this particular program, there was no definitive structure. In fact, each of the leaders was able to run the group in the way that suited them. So one of them did have a very prescriptive method. And she would basically say, this is what I'm doing. You need to follow my rules. To the extent, put your hand up before you ask a question. It felt a bit school-like. But everybody else fell into place and it ran. The second leader really sort of took over. She's more like a caretaker leader. So she followed a lot of what the first leader had done, but then she adapted it and said, look, I can't run all these sort of quizzes and things that you've taken off the internet. Actually, we're going to chat. And she made sure that everyone turned up and they had their cake and their biscuits and their tea, and they carried on having their lunches, and she maintained that sort of continuity. The third one just threw the baby out of the bathwater and said, you know what, let's do whatever we want. And she was that kind of a person. She was very relaxed, totally structureless, but that's what worked for her. And on that basis, she was prepared to put in her time. How she did this, I don't know, moving around all the tables outside of the retirement community, getting the umbrellas up. It was that magnificent summer, the first weather, you know, beautiful weather summer we had in the pandemic. And she was getting them all to meet round the corner in the garden where they couldn't be spotted. So that's a connection between structure and structured style was really important. The opportunity for feedback, I was listening to their feedback. I was getting to hear what was said, and they were also able to feed their information back into the Housing Association. So they were able to feedback, and they also realized they were appreciated. So again, peer leader number 1 was just so excited about the amount of thanks she was getting from the Housing Association. This making training available and accessible actually wasn't something that was brought up by the participants at all, but it touches on, not only touches on, it really echoes what Jolie was saying about digital inclusion. What became very clear was all 3 peer leaders were digitally engaged. They were able to use their laptops. They were able to access resources, and they felt really comfortable in that. And what I was horrified to hear was when COVID hit, a lot of them had no access to the internet, because the place where free access was available was in the communal lounge, which was barred to them. And a lot of them had not paid for it in their rooms. They did not get it as an inclusive service. I believe things have moved on, but at the very beginning, this was quite something, really quite shocking. So when I talk about make training available and accessible, yeah, it's not just making it available, but actually how do we support people in their learning? Consider if leadership can be shared. Again, that was really echoing the idea. The first peer leader, she really, as I say, put in a massive, great program of activities. And she was getting up at 4 o'clock in the morning to plan her sessions. Now, she loved that. She thought that was great. But I think she did say to me, please don't let my daughters know that I'm getting up at 4 o'clock in the morning. So she did realize there was a bit of a balance there. And she did actually become quite ill. I certainly hope it wasn't because of this. I think it was, she actually had some medical issues. And that's when we moved to the transitional leader. So this idea about sharing leadership, I think, is probably something that needs to be thought about. My next point about merging with an existing group, that's really reflection on the fact that the slimming group really formed the core here. However, it's not the panacea, it doesn't solve all problems. In fact, the other thing this group went through was a really difficult time when someone thought it was a very good idea. I think it was the Housing Association suggested, in fact, they should merge with another group up the road which didn't have a lounge. This created a complete, it was almost like, oh, I hesitate to, about to say warfare, but that's terrible given what's going on in the news at the moment, a really big battle of views, and they had to get mediators in to resolve it. So I'd say be very careful about mergers, and that perhaps links into consult members before making changes, because this was inflicted upon them. It wasn't done with their participation and in consultation. It wasn't a co-produced idea, done with the best intentions, but it really wasn't great. And actually the two groups, they each went their own way. And then I've also put in there, think about where the group is located. One of the things that came out of this research was quite interesting in that some of the people, when they were talking to me, they extended the conversations they'd been having within the group, and they explained that they weren't certain they could have had the entirety of that conversation in the group sessions, because they were not just coming to a group and participating with the group and then leaving at the end of the day, they were living with the people. So they did have to think about group dynamics and actually how is all this managed. And I know there was a point at which there was a consideration that perhaps the groups could be run in another area, which not actually the lounge of the housing association. So whilst very convenient, it does have the flip side as well, that perhaps people are having to be aware that they're not just in a social group, but they're also living with people. Now I realise I've overrun, so I'm going to sort of zip it now and look forward to hearing any questions.
Miranda, for someone who said may I want to speak for 5 or 10 minutes, you've done remarkably well, and you've really passionately, really, I can feel the passion in describing and sharing those experiences, the phenomenon that you described right at the outset, and articulated those really well. And I know you both have stimulated some questions in the Q&A box. But can I thank both of you for 2 really illuminating presentations, and both sort of sharing the findings, but also giving some of the insights of what was happening behind the scenes and in those engagement processes. And I'm sure you know, Wales had a stronger COVID policy than England at various points, so I'm sure meeting in public gardens wasn't appropriate. But these things happen, and you know, it demonstrates how the importance of keeping those social connectivity. So thanks ever so, and I know Sally's going to post a few links to various papers and reports that have been cited. She's been working behind the scenes, answering bits and pieces and moving slides forward and on, so she hasn't had a chance to catch up. But can also thank Paul for posting the link to the guide and the toolkit during Govi's presentation. We've had a handful of questions, and I'm just going to briefly go through these. I think by and large from Sarah and Emma, and I think one from Vicky or Alex, it may be Alex actually. Yeah, so Alex has posted something about, do you find any gender differences in experiences of using and or facilitating peer support group? So I don't know if that's first of all to you, Miranda, any differences, gender differences?
So in terms of the peer facilitators, the people who I spoke to, they were all female. However, the professional facilitators in the particular group that I was involved with, there was one female and one male. And there was actually, I would say that there were some interesting reactions. I think and I don't know if it was gendered or if it was actually just personality types, because they also have very different personality types. And the participants enjoyed both facilitators a lot, but they did mention quite a few times the male facilitator. Now, again, all my participants were female, and by the very nature, I know the groups were largely female. So actually trying to find male participants was quite hard. In fact, I wasn't able to find any. So I don't know, and I did know both of the facilitators quite well, and they did have very different personalities. So I'm slightly hesitant to say that it was gender, because I know that the male facilitator was really very outgoing, and the female facilitator was a lot quieter. So I don't know. I'm slightly loath to say my research suggests.
Yeah, no, that's helpful. But I think Alex also, I know Alex through other work, and I think she also would probably want to draw attention to some of the work that the University of Bristol have undertaken with the DICE project, which is looking at more broadly issues around social inclusion, and obviously issues around loneliness came through. And Paul Willis from University of Bristol and colleagues presented another happy hour a couple of weeks back on this. So if you wish to look at the DICE project and some of the comparables, I think that may be helpful as well for people listening and watching in. There's some more questions coming through around digital inequalities and digital exclusion, and I think if I just sort of go to issues that Emma has raised, Emma Williams, thanks ever so much for your questions. If you have any digital inclusion obstacles, in rural Wales, how do you overcome these? Any thoughts on digital inclusion, or in this case, exclusion?
I think that's so pertinent about in terms of geographical location, in terms of, yes. So I think it's a very big ongoing issue, and I think that it's something that as collectively for all areas that we have to look at. And I know not for this project, but a nature-based project, but prescribing, working in Somerset, we really haven't been able to get people online because Wi-Fi provision was so tricky in that particular area. So I think things will be changing a lot going forward, but at the moment I think that that people are definitely going to be excluded, not only on a basis of skill but a basis of access. And I just to pick up a little bit about kind of the gender of facilitators and participants, I think because I think it's really important. It was always felt that you would have people from different genders taking these groups in, and then I think in the London and England work we probably have had more male participants than in Wales, and I think that's possibly just a type of housing provision that we've operated in. But I do think I think that the relationships, I think a lot of it is a little bit to do with personality, but there's something that gendered that is played out in the quality of the relationships that happens.
Yeah, and I think not so much on the gender, but on the digital element. I think both of you in your presentations touched on the work of Helena Herklotz, who's the Older Persons Commissioner in Wales, and towards the end of last year, she was instrumental in pulling together the new age-friendly Wales strategy. But behind the scenes, she's also working closely with the Welsh Government to, in effect, sort of create a digital right for people in later life to have access to information and advice. And I think this is quite encouraging. There are other parts of Europe, and again, Miranda, you touched on European funding, but I know in Barcelona there is work underway to look at how there is a digital right to social responsibility in local communities to enable that to happen. In terms of connectivity, both through technology, but also to maintain those social networks and participate in the democratic process. So do have a look at some of the work that Welsh Government and Helena are looking at, in particular around digital rights for people in later life. I think that's quite exciting. Now, that may not overcome some of the obstacles that Emma highlights, but the rights-based approach, she has the powers to enforce local authorities to address this. So again, in metropolitan areas, it might be easier with blanket 5 and 6G platforms, but in rural locations, there's certainly obstacles, and something that one of the HAPPI rural reports also picked out with Lord Best, who I saw was in one of your pictures, Jolie.
Yes, he was, yeah.
Sarah raises a number of issues, again, links back to digital, but also she talked to us about the issues of transport. And just wanting to know whether people came to the sites, or did everybody live on the sites already? Or any other issues around transport that may have arisen. Actually, the London project, there was a great book that was published about the London bus, if I remember rightly, Jolie. But transport I think, was underpinning. But any other issues coming through the project in Wales?
So again, from my experience, the participants took part in the groups which were in their own housing scheme, And I say the one time they did try to invite people from the housing scheme up the mountain to come and join them, actually it was an unmitigated disaster. But that may have been because it was, within the housing scheme as opposed to in a neutral third place. The people from the other housing scheme were sort of encouraged to make their own way there, but they seemed to be able to do so. But I would think that the individuals that I was working with, they would have needed to have transport provided for them. And that did come up actually with the idea of training and support. I know that there was an intention to provide some sort of networking, training and support system. And one of the questions was, where is this going to happen, and how are the peer leaders going to be transported to the place? And they were very enthusiastic, but actually said, I can't get from gosh, where was I? A couple of hours outside of Cardiff to get into Cardiff for training. So I think the transportation point is a really pertinent one.
No, I'm just thinking in London with creating communities, we did actually bring people together from different schemes that were quite close to each other. And that was quite successful, but people came in taxis and there was budget for that. And that wasn't organised. That was organised by the scheme and the members of the project. So that actually was, there's something, there definitely needs to be a budget, but a nominated person to take charge of that process. And I think, then we get into thinking about digital groups, and obviously transport is not the issue. Then it's about having the technology and the skills to access those groups. So it's interesting, but I think there were particular challenges, obviously in Wales geographically.
Well, thanks both of you. I'm going to take the liberty just to ask one final question that's been posted. And again, this is from Sarah. Thanks ever so. You raise a really interesting one, and perhaps it's probably best that we leave this to last. Do you think the GP surgeries and others should provide the means to patients to enable the forced online methods they have implemented? So again, I think that relationship with GPs and any other sort of health professionals, was there any sort of evidence coming through in your work with the housing associations in Wales?
I'm going to take the option. It just wasn't something we discussed at all. So I can't help on that one.
For me, I think the pandemic has really changed this conversation completely. So part of Picture This is very much discussion about how to access your GP. There is some training, and there's some tech talks about how to access your GP online, perhaps how to download an app. So there's a support, but on a personal level, it seems completely incongruous that you would bring in a system that excludes people completely. This sort of digitalization has to be a process, but also if people aren't able to access it, there has to be ways for them to be included and not to be discriminated against, basically.
Yeah, and I think, Jolie, you talked about, sort of the only way to access an appointment was through an app. And if you didn't have a mobile phone or didn't have access to internet to do that, how that does create a significant disadvantage. I think the other thing, perhaps just put a slightly more positive spin on this, is that there are some really great pieces of work going on with Welsh housing associations, with their local NHS partners, both through the regional partnership boards, but also with GP practices. So pre-COVID, I remember United Welsh had a project very much based on social prescription methodology. And that's something we would very much like to, as a LIN, look back at, and how social prescription and community engagement can be part of what the LIN's been talking about, a collaborage approach, where we look at different collaborative models with community-led, cooperative, co-housing, but also collaborative care models as well. So again, we look forward to sort of sharing some of the insights on that. But we're just hitting 5:05 or thereabouts, and I just wanted to thank everybody for both some fantastic questions, some really great chat. As Sally said at the outset, we'll be sharing that along with the recording of this session and the slides of the PowerPoints. We very much hope you'll get those tomorrow, and then we will sort of draw attention to them again on our Friday newsletter links, which goes out normally mid-morning on Friday. If this is the first time that you've joined the HousingLIN Happy Hour, we try and run at least 3 or 4 of these every Tuesdays during the month. Our next one is next Tuesday, is looking very much at integrated retirement communities and looking at what issues are, challenges there are in terms of the way we invest in, how we plan, consumer, what's the market for integrated retirement communities, which for many are also known as extra care or housing with care. So please, if you wish to sort of learn a little bit more about how the sector is developing and the sort of growth of integrated retirement communities, please do join us, West Body Architects, ARCO and others, to have a good conversation on that. And then coming back to issues which are very relevant for Dementia Awareness Week, on the 31st of May is our final happy hour session of May. And we're running that with the Dementia and Housing Working Group. Please do join us for a number of new initiatives that are taking place. We were very much hoping that we would know about a new national dementia strategy. It may well come out by then, in which case we'll have an opportunity to peruse and review it as well and see what the housing and care elements within it, how they strike home. But without further ado, can I thank everybody for participating. Jolie and Miranda, two great presentations. Sally, thanks ever so behind the scenes. And for those of you who joined us, the participants, I wish you a pleasant and warm evening and look forward to seeing you at the next happy hour.
Thank you.
Thanks, everybody.